Welcome to the deep dive. If you're listening, chances are you might be getting ready for hyperbaric oxygen therapy, HBOT. And you're probably thinking about, well, what the experience will be like. Today we want to focus on something really crucial for comfort. Managing the pressure in your ears.
Absolutely. It's probably the most common physical sensation people notice, especially at the start of a session. Inside that chamber, the pressure changes.
Right.
And that directly affects the air spaces in your body. Your ears are often the first place you feel it. Understanding how to, well, equalize that pressure is key.
Key for avoiding discomfort, right? Or even potential, ear issues.
Exactly. It prevents discomfort, pain, and what we call barotrauma. We want the therapy to be smooth.
Okay, so our mission today is simple. Break down the techniques for equalizing your ears. Make it really clear, easy to follow, even if you've got zero medical background. No jargon, just practical steps.
Sounds good. Let's start with the why. Why does this pressure happen? It comes down to a basic physics principle, Boyle-Mariotte Law.
Okay, physics. Keep it simple for us.
Right. Basically, it just says that if you keep the temperature the same, when you increase the pressure on a gas, its volume shrinks.
Like squeezing a balloon, sort of.
Pretty much, yeah. Think about that little bit of air trapped in your middle ear space. As the pressure goes up in the hyperbaric chamber during that initial phase called compression,
Compression, okay.
the air in that middle ear space gets squeezed, its volume decreases.
And if the pressure inside your ear doesn't match the pressure outside in the chamber, that's the problem.
That's exactly it. Your eardrum sits between the middle ear and the outer ear canal, which is open to the chamber pressure. If there's a pressure difference across that eardrum...
You feel it, that fullness or popping sensation?
Precisely. First fullness, then maybe discomfort, and if it's not addressed, actual pain. That significant pressure difference is what can lead to barotrauma, a pressure injury.
And this isn't just HBOT, right? Like flying.
Same principle. Flying, scuba diving. Anywhere you experience a relatively quick change in ambient pressure. HBOT just involves, potentially, a larger pressure change than commercial flying.
Okay, so our body has a way to deal with this naturally, doesn't it?
It does. We have these amazing little things called Eustachian tubes.
Ah, yes, the Eustachian tubes.
They're tiny channels that run from the back of your throat, the upper part of your throat behind the nose, up to your middle ear space.
So that's the connection.
That's the pathway. When that tube opens, even briefly, it allows air to flow in or out of the middle ear, balancing the pressure with whatever the pressure is in your throat, which reflects the chamber pressure.
But sometimes they don't just pop open on their own when you need them to. Maybe you're a bit stuffy or they're just stubborn.
Exactly. They're normally closed. Actions like swallowing or yawning can open them briefly. But under increasing pressure, sometimes they need a bit of active help to open up.
And that's where these specific techniques, these maneuvers, come in.
Correct. These are ways to physically encourage the Eustachian tubes to open and let that pressure equalize. Should we start with maybe the most well-known one?
Let's do it. The Valsalva, I'm guessing.
You got it. The Valsalva maneuver. It's pretty straightforward to describe.
Okay, walk us through it.
Right. So first, you pinch your nose completely shut with your fingers.
Okay, pinched.
Then close your mouth. Keep it sealed. Now, the key part. Gently try to blow air out through your nose. But remember, your nose is pinched shut.
So the air has nowhere to go out the nose.
I see.
You're building pressure behind the nose.
Exactly. You're increasing the pressure in your throat and nasal cavity. The idea is that this pressure pushes air up into the openings of the Eustachian tubes.
Forcing them open.
Helping them open, yes. And allowing air into the middle ear to balance the pressure. Now, the word you used earlier is vital. Gently.
Right. Not like blowing up a stubborn party balloon.
Definitely not. Too much force isn't good. It can actually strain things, maybe even make you feel a bit lightheaded. Just a gentle, steady push is usually all that's needed. You might feel a little pop or click in your ears when it works.
Okay, pinch, close, gentle puff. Got it. What's another option if that one doesn't feel quite right?
Another popular one, especially in diving, is the Frenzel maneuver. This one's a bit different, uses throat muscles more.
Okay, Frenzel. How does that work?
Again, start by pinching your nose shut and closing your mouth.
Standard start.
Yep. But instead of blowing from your chest or lungs like the Valsalva, you use the muscles at the back of your throat. Try making the sound of a K or G silently.
A K sound. Try silently. Okay, I feel muscles moving at the back of my tongue and throat.
That's it. That movement, especially the upward push of the back of the tongue against the soft palate, acts like a piston. It pushes the air that's already in your throat upwards towards the Eustachian tube openings.
Ah, so it's more localized pressure right there in the throat, not coming all the way from the lungs?
Exactly. Many people find it requires less effort overall than the Valsalva and might feel a bit more controlled once you get the hang of it. It can take a little practice, though, to isolate those muscles.
I can imagine feeling that K sound push. Okay, so Valsalva is the puff, Frenzel is the throat tongue push. What else is in the toolkit?
There's the Toynbee maneuver. This one is often seen as, well, gentler still.
Toynbee.
Again, pinch your nose shut. But this time, instead of blowing or making a sound, you just swallow.
Just swallow while pinching my nose. Seems almost too simple.
It sounds simple, but the act of swallowing naturally pulls the Eustachian tubes open for a moment.
Ah, okay.
By having your nose pinched while you swallow, you help ensure that the pressure change during that brief opening equalizes the middle ear effectively. It works really well for some people, especially for smaller pressure adjustments.
Okay, pinch and swallow. That sounds like a good one to try frequently. What else is something even less active?
Well, there's simple jaw movement, sometimes called the jaw wiggle or lateral jaw movement.
Jaw wiggle. Okay, tell me more.
Keep your mouth closed and just gently move your lower jaw side to side.
Like you're chewing very subtly.
Yeah, or you could also try jetting your jaw forward slightly and then pulling it back. Think of yawning movements, but much smaller and controlled.
And just moving the jaw helps.
For some people, yes, that movement can kind of tug on the tissues around the Eustachian tube openings, helping them to open up a bit. It's often good for minor pressure feelings or in combination with other techniques like swallowing.
Interesting. So a little wiggle might do it. Now, I heard there's one that's like a pro-level technique.
Ah, you mean voluntary tubal opening, or VTO.
That's the one.
Yeah, this is where some individuals, with practice, can learn to consciously control the tiny muscles around their Eustachian tubes, the tensor veli palatini muscles, specifically to open them at will.
Wow. Without pinching or swallowing or anything.
Yeah, they learn to contract those specific muscles in their soft palate and throat, kind of like wiggling your ears, but internally.
That sounds difficult. How do you even learn that?
It takes a lot of body awareness and practice. You have to learn to feel those muscles and gain conscious control. It's not something most people can do right away or even need to learn for HBOT. Usually the other techniques are more than sufficient.
Okay, so that's probably not the first one to focus on if you're just starting HBOT.
Probably not, no. Stick with Valsalva, Frenzel, Toynbee, or the jaw movements first. Find what works for you.
Right, so we've got the techniques. Valsalva, gentle puff. Frenzel, throat push. Toynbee, pinch and swallow. Jaw wiggle, and the advanced VTO. Now let's talk about using them during the therapy. What are the key tips?
Number one, absolutely crucial. Equalize early and often.
Don't wait.
Don't wait until your ears feel really full or start to hurt. As soon as you feel the slightest pressure change during that initial compression phase, do your preferred maneuver.
Okay.
And keep doing it frequently. Every few seconds, or with every small increment of pressure increase you feel. Little adjustments often. It's much easier to keep pace with the pressure than to try and clear a big difference that's built up.
That makes a lot of sense. Stay ahead of the game. What else?
Try to stay relaxed. I know, easier said than done sometimes, but tension, anxiety, it can actually make your muscles tighter, including those around the Eustachian tubes.
Making it harder to open them.
Exactly. Take slow breaths, try to remain calm, trust the process and the techniques.
Good advice.
Yeah.
What about things like decongestants? Should you take one beforehand just in case?
Generally, no, unless your doctor or the HBOT clinic specifically advises you to.
Oh, okay. Why not? Seems like it would help.
Sometimes they can help, but over-the-counter decongestants can also have side effects, like rebound congestion later, which could make things worse for subsequent sessions. Always, always follow the medical guidance from the professionals managing your HBOT. Don't self-medicate for this.
Got it. Doctor's advice first. Now, what about the other end of the session? When the pressure is coming back down, the decompression.
Ascent, or decompression, is usually much easier for most people.
Why is that?
Because as the external pressure decreases, the air trapped in your middle ear expands. This pressure difference usually pushes the Eustachian tubes open passively, letting the excess air vent out naturally. Think about your ears popping easily on the way down in an airplane.
Right. So usually less of an issue, but still good to be aware.
Still good to be aware. Occasionally, someone might experience a reverse block, but it's less common. If you feel pressure building on ascent, the same gentle techniques like swallowing or jaw wiggling can help.
Okay. And the most important tip probably, what if you try these things and you're still having trouble or it starts to hurt?
Communicate immediately. Signal the hyperbaric technician inside or outside the chamber. There's always a way to communicate.
Don't just sit there in pain hoping it gets better.
Absolutely not. Tell them you're having trouble clearing your ears or that you feel pain. They are trained specifically for this. They can slow down the compression, pause it entirely to give you time to equalize, or even bring the pressure back up slightly before continuing more slowly.
Okay, that's really reassuring. They can adjust the process for you.
Completely. Your safety and comfort are the priority. They expect people to need help sometimes. It's totally normal, so speak up right away.
Fantastic. So let's recap the big takeaways. Know the techniques: Valsalva, Frenzel, Toynbee, jaw wiggle.
Practice them gently beforehand so you know what works for you.
Equalize early and often during that initial pressure increase.
Stay as relaxed as you can. Follow medical advice on decongestants.
And most importantly, communicate immediately with the staff if you have any difficulty or pain.
You've got it. Understanding and practicing these things really paves the way for a comfortable, positive, and effective HBOT experience.
Absolutely. And that practice beforehand, just sitting quietly and trying a gentle Valsalva, or seeing if you can feel the Frenzel kick in, or just swallowing with your nose pinched, it takes the mystery out of it, doesn't it?
It really does. It builds confidence. So when you're actually in the chamber, it feels familiar, not like something brand new you're trying under pressure, literally.
Yeah, exactly. The goal is effective therapy, and being comfortable is a huge part of that.
Couldn't agree more.
So hopefully that clears things up about clearing your ears. Now that you've got a handle on the how of your equalization, perhaps it raises other questions. What other aspects of preparing for hyperbaric oxygen therapy are you now curious about? Thinking about that might guide our next deep dive.